A temporary prosthesis protects a tooth after it has been prepared for a crown, for example. The temporary prosthesis can be produced and set in the patient's mouth directly by the dentist, or it could be done in a dental laboratory. Thanks to temporary prostheses, no one needs to leave the clinic with missing teeth. There are very many types of prostheses, and we'd like to introduce a few of them to you. Here you see a temporary prosthesis on the plaster model. Due to a bone replacement operation and subsequent planned implantation, the patient has received a plastic temporary prosthesis for her front teeth. The bone replacement operation and the fixing of the implant have been done, and the so-called gum former will be screwed into the implant and left there for a few days. The plastic temporary prosthesis will now be fixed over the ground-down tooth stumps and over the gum former, and the fit will be checked accordingly. With ceramic inlays, a temporary prosthesis is needed in the form of a special kind of rubber which is put onto the ground tooth. Dryness is an important factor for the hold of this type of temporary prosthesis. The rubber is hardened by means of a halogen lamp. This temporary prosthesis seals up the tooth for a week as a rule. There is a broad range of further possible treatments. Here you can see teeth which have been made in advance out of plastic shells. These will be filled with a white liquid plastic, placed over the ground-down stumps, then hardened by means of light, and voila! The stump is protected against heat and cold for a good period of time, certainly long enough for the patient to have her permanent crowns made and fixed. The so-called instant prosthesis, seen here in the picture, is used as a quick replacement after a series of extractions or the loss of several teeth. In this case, the patient fell and in the process knocked out 3 of his front teeth. Only hours later, he got a temporary solution with which he can speak. The instant prosthesis is fixed to the neighboring teeth by means of wires, and these wires may damage these neighboring teeth, so instant prostheses are only allowed to be worn for short periods of time. Temporary prostheses can also come in very complicated designs. Here you see a patient who has no teeth left in her upper jaw, and a bone replacement operation with subsequent implantation has been planned. Treatment time will come to about 7 months, and for this time the patient will wear a so-called palate-free hybrid prosthesis. In the top right photo you see that the palate is not covered, hence the use of the term palate-free. 2 small beads fixed to implants, as seen in the bottom right photo, secure the prosthesis. The bottom left photo shows the prosthesis from underneath, and you can see the incorporated counter-elements. Above left, you can see the prosthesis in the mouth. The combination of good looks, comfortable fit, and the good bite make the waiting time easier for the patient.